The country has recorded one of the highest number of COVID-19 deaths in a single day. 19 people have died, bringing the total tally to 238. Infections have also been increasing, with 12,739 cases in the country. While the Health Minister joins me via Skype for more on this, as well as South Africa's strategy going forward. He, of course, spent the day in the Eastern Cape with the President and officials in that province to see their readiness and the strategies they're implementing to fight COVID-19. Dr. Mkhize, good evening. It's a pleasure to have you on News at Prime.
Good evening, Kathy, and all the viewers.
Let's talk about the numbers. Before we get anywhere, I'm assuming that the numbers that we have are the latest numbers, but perhaps you want an opportunity just to run us through the numbers that you have?
Well, the total number of new positives has come to 12,739 people who have tested positive. That is also comes with 238 who have passed away. And then recoveries are 5,676. We have actually at this point screened 403,000 people across the country.
Sure. Thank you so much for that, Minister. There are a couple of issues that we need to get through because, of course, we're approaching a critical time when it comes to the level of lockdown that we have in the country. Firstly, the President today in the Eastern Cape was emphatic in saying that we will move to level 3, and that could very well be before the end of May. And as far as indicators or measures that you're using in advising the President about when to make these decisions, what are the markers that show that we're ready for level 3?
Well, let me say, I think that the President has led the whole campaign against COVID-19 very well. We have had very strong decisions taken. The decision to do a lockdown was a very timeous decision. It has allowed us to screen almost 10 million people, then to test 403,000 of them. The time we gained has also allowed us to deflect the curve so that we're flattening the first part of the curve. Now what we know is that roughly in the country there is community spread of the infection, and that spread is going to be with us for a while. And our approach, therefore, is we're changing the strategy. We're going to focus now on what we call hotspots. So what we are seeing in the Western Cape and in the Eastern Cape is largely what we call cluster outbreaks, which means that, whilst the rest of the country has been contained in the way the infection has grown, but in the certain parts of the country, you have clusters like in retail shops, like in factories, where a large number of people get infected at the same time. And this is the focus we're taking now. We're going to focus on dealing with the hotspots, and to do so, we have now gone on a strategy to work together at provincial, national, and local government, divide the places up, and therefore go for all those who are positive, as well as the contacts, test them, then take them for treatment, isolation, and quarantine, and then look at the whole area to see if there are any new problems of people who are coming out positive. In an area where there's an outbreak like a factory, we're going to have to make sure that there's surveillance, but at the same time we will intervene if there's infection. We're actually quite convinced that what we are seeing in the Western Cape is more because the numbers have suddenly shot up because of the cluster outbreaks. But if you go to the other parts of the country, as we let go of the lockdown, you are likely to see outbreaks appearing in other towns and other districts. So we need to shift our approach and emphasize on individuals taking responsibility to, for hand sanitizers, for, cough etiquette, for masks and all of this. We're going to be much stronger there because the only way to coexist with COVID-19 now is that we must insist that there must be behavioral change, and that's what the President's message was all about.
At which point, Minister, will we know if even those hotspot outbreaks are contained? Because, of course, having many little hotspots ultimately contributes to the overall rate of infection. So when it comes to the bigger picture, when are you going to say we're still okay, or that, in fact, perhaps we need to change to a stricter level of lockdown?
Well, the information is actually available now. We have looked at the rate of the infection that we have found, the rate of positivity that we have seen across the country. I can tell you now that we have identified about 5 different levels. The first 1 or 2 have got very little infections, which means they either have no new cases or never had cases, or they have not got an increase in the numbers of cases. Then the last few are the ones where you've got outbreaks and the numbers are going very high up, and therefore you can see the numbers of new infections is still rising. Those 2 areas are not going to be treated the same. So we will therefore be moving from area to area to make a distinction as to whether in the areas where there's low transmission, we have returned to normality slowly, but in that area we need to then make sure that we deal with those who are positive so that they can be healed of the infection, and the contacts are also taken to quarantine, and we watch for new infections that come into that area. That's more the vigilance we're going to be putting in there. Then when we deal with the hotspots area, we're going to divide a district or a metropolitan area into a number of clusters. In that cluster, we'll put up permanent teams of health specialists, epidemiologists, public health specialists, family practitioners, nurses, community health workers, and so on. They will then do a wall-to-wall scan of that area. Make sure they account for every person who is COVID-19 positive, who needs to be treated, and make sure that they've got a place where they refer all those people for quarantine, and then look after those who might be appearing after. They must look into the cluster areas. They must look into the social and economic activities in that area and recommend the approach. That means there will be stricter restrictions in some of the areas which are not the same. So there will not be a similar way of managing every district in the country. Where the infection is higher, there will be stricter conditions. Where the infection is less, there will be less strictness, and everything in between will be managed on that basis. So when the President was talking yesterday, he was indicating that we are prepared to move forward, but it means that we will move further where there's less infection, but we will have to maintain strictness in the areas where the infection is still very high.
Minister, it sounds like it's going to be quite a nightmare to try and manage. And how much of it is going to be centralized within the provincial governments? Or are you going to be relying on the districts to be able to handle this? Because, of course, that calls into question the kind of capacity and resources that would be able to be deployed to the different hotspots.
Well, we are actually up to the challenge. We are going to do whatever it takes to make sure that this issue is managed. So as a matter of interest, I've been all over different provinces to make sure that we are satisfied with the plans that they are putting in place. The plans were guided rightly from the national ministry, department level as to what intervention we need to do. The provinces have designed the plans. They are very happy with it. They are deploying people. The districts are working together with the provinces. So all in all, we are going to find that everybody, local leadership, provincial leadership, national leadership, is going to be working in exactly the same spot at the same time, doing the same thing, and make sure we take responsibility as all spheres of government for what progress there is in the fight against the COVID-19. We will not give out numbers just now, but what we expect should happen is that for every area, they must be treated on the basis of the progress they are making. Those that are improving will obviously have to be given more opportunity to open up more social and economic activities. Those that are having a difficulty, there's going to be a lot more of strictness in the way we deal with the return to normality. So it will not be a one-size-fits-all. It will be based on what we are finding as the problem, and we will solve the problem as we come across it. And so far as we are concerned, it will be government. And I'm very happy to say that at this point we are going to work as government, and as we've already been working as government, doesn't matter whether national or provincial or local government, we'll all be on the same spot working together. That is what the president has actually guided us to say. Let's make sure that everyone is there to give support to the communities where the impact of the infection is highest.